All right, so this video number 2, the first one was on motivation, okay? This one is 2 kind of quick concepts within motivation. We have hunger, and we have, which this unit does not cover the eating disorders. It previously used to, but I think we're going to do eating disorders when we do abnormal and disorders and treatment later on this year. Okay, so we're just going to do kind of the motivation of hunger, the biological stuff, and also we're going to talk about the sexual response cycle. Okay, so this should be really quick because I'm not going to do everything we did in class. I'm just going to do the basic things that you really need to focus on. Okay, so the brain, all right, so the hypothalamus has a huge role in hunger, all right, whether you feel hungry or whether you feel full. There are 2 different parts that you need to know, and you need to know the difference between the 2. Okay, so you have the lateral and the ventromedial hypothalamus, okay? So this is the phrase that I always tell myself to help me remember. Late, like lateral. Lateral has the word late in it, okay? So I think if I'm late for lunch, I'm hungry. If I'm late for lunch, I'm hungry. So you can say that to yourself. I'm late for lunch, I'm hungry. The lateral hypothalamus is what makes you hungry. It says, I am hungry, okay? The ventromedial hypothalamus is what makes you feel full. I am full, okay? You can maybe make something up for yourself like medial, like dial back, like you're full. I don't know, something like that, all right? But I'm late for lunch, so I'm hungry. So when the lateral is stimulated, you're hungry, all right? And then when the ventromedial hypothalamus is stimulated, you feel full. Lesions, all right? So anytime you have damage to the hypothalamus, all right, whether it be through a lesion, destroying of a part of it, or through a tumor growing, any sort of damage, can impact how hungry or full you feel and can impact how much you eat and weight gain and things like that. All right, so let's say you have a lesion or a tumor on the lateral hypothalamus. I'm late for lunch, so I'm hungry. If that part isn't working, then you don't feel hungry. You wouldn't maybe necessarily eat as much and you would lose weight. All right. If you have a lesion or a tumor, some sort of damage to the ventromedial hypothalamus, this is oftentimes the example that they use on the AP exam. There's a lesion or a tumor on the ventromedial hypothalamus. What are some of the symptoms that they're going to have? Well, if their ventromedial is not working, they're not going to feel full. So they're going to eat more. And this overeating can lead to weight gain and to obesity. All right, so when the ventromedial is lesioned, things like weight gain and obesity happen because you never feel full. All right, so remember, I'm late for lunch, so I'm hungry. All right, and kind of keep in mind what lesion and destruction and tumor and things like that do to this. Okay. You know, glucose impacts your sugar levels, impact how you feel hungry. When your glucose levels drop, your hunger increases. There are other hormones that your book talks about. While that's nice to know, I don't know that that's completely necessary for you to focus on for your studying. Okay, we're going to skip all this stuff. Culture. Eating disorders, like I said, we're going to do before. All right, sexual response cycle is really easy. There's kind of 3 major parts of it. So this is by Masters and Johnson. The first one is knowing the order of the sexual response cycle. Excitement, plateau, orgasm, resolution. All right, so maybe you want to make up some sort of mnemonic or EPOR or something so that you can remember the order, because you do need to know the order of this. The second thing that's important to remember is refractory period. Refractory period is this period of wait time where the body has to, it's during the resolution, the body has to go back to homeostasis, has to reset. For men, refractory is much longer than for women, so men are not capable of achieving orgasm, you know, right away after the first orgasm, versus women have a much shorter refractory period. So the difference in the sexual response cycle for men and women is that men have a longer refractory period and women have a shorter refractory period. The third thing is the hormones. Okay, so remember that estrogens are female sex hormones and testosterone is a male sex hormone. Okay, and I think that was it for this video because I want to do a whole separate video for emotion. Okay, so we'll stop this one here and we'll go to the next one.